Hello and welcome to my presentation about the heart. The structure of the presentation, we have four main topics: the anterior, inferior, posterior and the lateral surface of the heart, the syntrophy of the heart, heart fixation apparatus, the skeletotopy of the heart and its valve, and according to this, the point of their auscultation. Structure of the heart, also called core, is a powerful muscle that pumps blood through the vascular system. In doing so, it ensures that the blood is enriched with oxygen before it reaches to the organs. The heart does this by first pumping the blood into the pulmonary circulation. From there, it returns to the heart, which then passes on to systemic circulation. Here we see the pulmonary tracts, and here the aorta and the vena cava superior and the vena cava inferior should be down here. In the pulmonary circulation, also called small circulation, the low oxygen carbon dioxide rich blood is transported to the lungs. There it releases the oxygen dioxide and absorbs oxygen before flowing back to the heart. In the systemic circulation, also called large circulation, including the vena cava superior, inferior and the aorta with their branches, the now oxygen rich blood flows from the heart to the organs, releasing the oxygen there and flows back to the heart as oxygen poor and carbon dioxide rich blood. And here we have a picture of the systemic arteries and veins, for example the vena jugularis interna externa, and parallel to it we have the arteria carotis interna externa and carotis communis, the subclavian vein and artery, the vena cava superior and vena cava inferior, the aortic arch and the aorta with the different branches. Also here the arteria iliaca and vena iliaca, and the veins to the leg, the vena femoralis and arteria femoralis. Anatomically, the heart is made up of two chambers, ventricles, and two atria. The so-called cardiac cavities, they are separated from each other by heart valves and are connected to the systemic or pulmonary circulation. The connective tissue separates the artery and ventricular myocardium. At the valve level of the heart, it's known as the cardiac skeleton. Here we see the right atrium, the left atrium, the right ventricle here, and here the left ventricle. In this picture we again see it, but this picture is special. This is the heart in the 5th to 7th week, which isn't for the adult, it's when the heart develops. And what we see important differences, we have, for example, foramen ovale, which is then later closed. Vena cava superior and vena cava inferior is the same. Here we have the valva atrioventricularis dexter, also called valva tricuspitalis, and here the valva mitralis, also called valva atrioventricularis sinister. Valve aorta, here it goes to the aorta, and we normally have also the valva truncipulmonaris, which is then here located. Yes. Ductus arteriosus, also important part, because this changed later to ligamentum arteriosum, which is then closed and turns to a ligament, like this closed here. Here we see the circulation of the heart. The foramen ovale was located here. The ductus arteriosus, the connection between the aorta and the pulmonary, is here, which also later closed. The HEPA, we have here also ductus venosus, which then turns to ligamentum venosum. Also important. Here we then see the ligamentum anteriosum, which turned to here the fossa ovale, the foramen turns to a fossa if there's no genetic modification and the fallout. We have a hard fallout, a failure. Yes, here again the atrium dextrum, ventriculus dexter, the ventriculus sinister, and the atrium sinister. Here the aortic part, the HEPA. Here, like I said, the ligamentum venosum out of the ductus venosus, and then we also have a second ligament, the ligamentum hepatic teres, which was also before it a vein. Here another picture, here in gross section. Here we see the left atrium, the right atrium, the right ventricle, and the left ventricle. And here we see like the blood circulating coming from the vena cava superior and vena cava inferior to the right atrium, going through the tricuspidal valve, going to the pulmonary, from the pulmonary arteries. It's turning back to the four pulmonary veins. We have 4 pulmonary veins going through the mitral valve and then to the aorta, and then the aorta spread the blood to the body. So to the location, the heart is located retrosternal in the middle mediastinum, and it almost completely surrounded by the 2 leaf pericardium. Most of the cardiac mass is formed by the heart muscle myocardium, which is lined with endocardium towards the lumen and covered by the epicardium towards the outside. Here we have the heart. Here we have the right lung, the left lung, and we see that it's in the middle mediastinum located. Here another picture. Here we have the lung. Here we have the, from outside view, the ventriculus sinister, ventriculus dexter, the apex cordis of the heart, the atrium dexter. Here we have the atrium sinister, the pulmonary, vena pulmonary dexter and vena pulmonary sinister, and the location of the heart. It's in the front of the trachea. The thorax surface relation of the heart, the projection. Here we have it on the X-ray, the heart projection, and here on the skeletotopy. So the apex of the heart, apex beat here 9 centimeters to the left of the mid-sternal line is the palpation point. The coronary sulcus, the right end, 2 centimeters from the 6 right sternal articulation, the linnet of the superior vena cava, here on the top, here is the third right costal cartilage, 1 centimeter from the lateral sternal line. Here we have the lateral sternal line. Yes, and the coronary sulcus, the left end, the third left costal cartilage, 3 centimeters from the lateral sternal line. To remind you, the mediastinum, we have the superior mediastinum. It's from the 3rd and 5th rib. It's from the it's here on the back side. It's from the 3rd and 5th vertebra, and in the front it's the sternal angle, which divide the superior part and the inferior part, and the inferior part is divided in 3 parts: the anterior, the middle, and the posterior. And in the middle, the heart line is located. In the back part, the esophagus and the other organs, the bronchi, the lungs, the trachea is located. The aorta also we see here. Here another good picture. Here we see the middle part, the small anterior, the posterior, and here we see the aorta is located. The nervus vagus is behind the arteria, behind the heart. The right and left to the heart is the nervus phrenicus sinister, and on the other side we have nervus phrenicus dexter and arteria and vena pericardio phrenica. The syntophy. The heart lies within the thorax and the middle mediastinum, which is contoured projection onto the second to the fifth rib. Second to the fifth rib. Above the base of the heart ends about 2 centimeters beyond the right sternal border, below the apex of the heart borders almost on the left medioclavicular line. Laterally, the heart is bordered by the 2 pleural leaves of the left and right lungs. Projection of the heart, the great vessels onto the chest. The left atrium is in direct contact with the esophagus on the dorsal side. Ventral to the heart is the anterior chest wall with the sternum and the thymus behind it. Caudally, the heart sits on the diaphragma, which is fused with the pericardium. So we have this surface, the inferior surface, the superior surface with the aorta, with the trachea, with the thymus, and inferior we have the sternum. On the back we have the esophagus. On the right and left we have the lobes of the lungs. The longitudinal axis of the heart lies obliquely in the thorax from right dorsocranial to the left ventricular. The inclination is approximately 45 degrees in the horizontal as well as in the sagittal and frontal plane. Here we see that it's again the syntophy, it's 1/3 to the right side from the linea mediana anterior and 2/3 to the left side of the linea mediana anterior. Here we have the linea midiclavicularis and it's located 1.5 centimeters from it and approximately to the 6th rib, and we see the 45-degree change of the axis of the heart, and here we have the base of the heart and the apex. Again, this picture from the side view, we have the aorta to remind you, the esophagus from the back, the vertebra in the back, the vena intercostale superior sinister, the veins and arteries intercostalis, and the sympathetic tract. Inferior we have the sternum of the heart. On top the arteria, the aorta. On the back, on the lower, the inferior part, we have the diaphragma. And here we see the midclavicular lining here, and 3.5 inches to the 5th space. We can find the beat of the apex by palpation. The right cardiac border is located approximately 2 centimeters next to the right sternal border. Starting from the 3rd to 6th costal cartilage, the left cardiac border is projected onto a connecting line between the lower edge of the 3rd rib to 3 centimeters parasternal left up to the 5th intercostal space in the left intermedioclavicular line. The apex of the heart can be felt in the 5th intercostal space medioclavicularly here. The valves, the atria and ventricles, are separated by thick collagenous connective tissues, which is also known as the cardiac galetotopy, as I already. This forms fibrous rings of connective tissue around the third heart valves because these are all lie on the plane that corresponds to the sulcus coronaris on the outside. This plane is also refers to as the valve plane. Here we see all 4 valves, starting with the mitral, with the valva atrioventricularis sinister, valva mitralis. Here we have 4 cuspis parts. We have cuspis commissuralis sinister, cuspis anterior, cuspis posterior, and commissuralis dexter. Here trigonum fibrosum dextrum and trigonum fibrosum sinister surrounds the mitra. Then valva atrioventricularis dexter, also valva tricuspitalis, has 3 parts: the cuspis anterior, the cuspis septalis, and the cuspis posterior. Valva aorta, here we have it. This is where the aorta comes through. We have the valva semilunaris sinister here, the valva semilunaris dexter, and the semilunaris posterior. And here, when we have here the posterior part on the valva truncipulmonalis, we have here the anterior part of the valva semilunaris, like you can remember it like this more easily. And here we have again the dexter and the sinister, and the anterior and posterior. That's how you can remember it really easy. So the location, the valve site of projection, the mitral to the left of the sternum at the level of the third costosternal articulation, the aortic in the middle of the sternum at the level of the third costosternal articulation, the pulmonary in the second intercostal space 1 to 1.5 centimeters to the left of the sternum, and the tricuspid on the sternum midway between the third left and fifth right costosternal articulation. The heart valves are essential for the direction flow of the blood. There are 2 types of valves in the heart: the valvular valves, the atrioventricularis between the aorta and the ventricles, tricuspid valve, valva tricuspitalis, valva atrioventricularis dexter between the right atrium and the right ventricle, bicuspid valve, mitral valve, valva mitralis, valva atrioventricularis sinister between the left atrium and the left ventricle, semilunar valves, valva semilunaris between the ventricles and the great vessels, pulmonary valve, valva truncipulmonalis at the transition from the right ventricle to the pulmonary trunk, and the aorta valve, valve aorta at the transition from the left ventricle to the aorta. When auscultating the heart, a distinction must be made between heart sounds, physiology, and heart murmurs, the pathologically. Here we have the sternum, and behind the sternum we have the heart. Here we have the auscultation points. Starting always with the first point is the apex in the fifth intercostal space, locating to the mitral, to the midclavicular line, then to the aortic is in the second intercostal space to the right border of the sternum. The pulmonary is the third point where we auscultate. It's for the pulmonary valve to the, also in the second intercostal space, to the left sternal border. And the fourth is the tricuspid valve in the fifth intercostal space to the lower left sternal border, a little bit higher than the apex. And the apse point is the last point where we auscultate, is in the third intercostal in the third intercostal space. Here we have again the same picture for better view. And here, without the skeletal topy on the surface of the body, here we have the valve tunci pulmonaris. The sound projects to the second intercostal space to the left side. Here we have the valva aorta, which projects the sound to the right second intercostal space. The atrioventricularis dexter, which projects the sounds to the right lower border of the sternum on the fifth intercostal space, and the apex, which then the apex is the projection of the atrioventricularis sinister of the valva mitralis. And then we have the normal sound, the first sound, the second sound. Normally we have the first sound is not really possible to hear, and then the atrial sound, and then we have the aortic stenosis. Then we have the large sound of the first sound combining with the second sound. Then mitral regurgitation. There we have a disturbance of the mitral valve, and then we don't hear a sound. Here we have a strong closing because we have hypertension. Aortic regurgitation, here we have the special sound in the second, because the second sound, the blood, because the aortic valve doesn't close good enough, the blood flows back to the heart, and then we have this sound. Mitral stenosis is when we don't have really a sound, and then pancreatic ductus arteriosus, then we have not a clear sound, only always like a weird waving sounds. Here we have the different points of auscultation. The first, the apex, then the second, the right second intercostal space, then the third, the left intercostal space, and then we have here the fourth part in the right lower border of the sternum, and then we have the Erb's point, also called Epstein-Erb's point, is found in the third intercostal space on the left side of the sternum. It is one intercostal space below where the pulmonary valve is auscultated. Here we have, like on the other picture, in this region we have the pulmonary valve, and here we have the Epstein. Surfaces of the heart. Now coming to the surfaces of the heart, like we see on this picture, the apex of the heart and the base of the heart. So we have 1, 2, 3, 4, and 5 surfaces, but we don't call it, the base is one of the surfaces. So beginning we have the anterior surface. Here we see the anterior surface on the picture, then the left pulmonary surface and the right pulmonary surface, and the diaphragm surface and the apex. The cranial and dorsal surface of the heart, where the large vascular trunks and is called the base of the heart, base cordis. The opposite and is also called the apex cordis. Here we see the base, the back part. It's where the vena cava superior, the aorta, and the pulmonary trunks starts. Is the start, and then when we have the vena cava inferior and the diaphragmic part is where the base ends. Left to the right we have the surfaces of the lungs, the right borders, the upper border, left border, and lower borders. We have 4 borders. This is the thymus border, the vena cava superior, the aorta, and the lower border is the diaphragma, the right border is the lung, the right lung, and the left border is the left lung. The heart basal surfaces, again, here we have the right pulmonary artery, lower right pulmonary vein, the upper right pulmonary vein. Relation of the base of the heart, here the relation, the base is connected to the esophagus. Here we have the nervus vagus with the nervus recurrens, with the nervus laryngeus recurrens here on the left side under the aortic arch, and on the right side under the subclavian artery. The esophagus with the nervus vagus on the left side going into the anterior side, and the nervus vagus of the right side going to the back side of the esophagus, the descending thoracic aorta also lying on the base, the diaphragma, vena cava inferior, and the trachea with the bifurcation trachea, the split of the trachea to the left and to the right part. The facies sternocostales cordis. The facies sternocostales cordis is the side of the heart that lies on the breastbone, the sternum, and the ribs, the costa. It is convex in shape and is mainly formed by the right ventricles. Here we see the frontal part, and is mainly made out of the ventriculus dexter. This part with the apex, and on the side view here we see the anterior part lying to the costa and to the sternum, the lateral surfaces and the back surfaces to the esophagus and the aorta and the vertebra. Facies diaphragmatica cordis, the lower part containing the atrium sinister, atrium dexter, the vena cava inferior, part of the ventriculus dexter and part of the ventriculus sinister, and also maybe mention the sulcus intraventricularis posterior. The facies diaphragmatica cordis is the side of the heart that lies on the diaphragma. It is formed by the 2 ventricles, with the left ventricle accounting for the slightly large proportion of the surface heart. Here we see how it lines on the diaphragma and is connected to the diaphragma. Also the back part, the esophagus again, the aorta, the thoracic part, the anterior part with the ventriculus dexter. Here, ventriculus dexter. In the front part to the sternum. Facies pulmonalis cordis. The facies pulmonaris cordis is the area of the heart that lies on the lung pulmo, the right atrium, facies pulmonaris dexter, and the left ventricle, facies pulmonaris sinister, are in contact with the lungs. Here on this picture, you should see it a little bit. And here we also see how it's located. The lungs surround the heart. Also, if we breathe, we can change the blood pressure depending on the depth of the breathing, because the lungs push against the heart, and then we have a stronger constriction. Facies posterior cordis. The facies posterior cordis is the side of the heart that faces dorsally towards the posterior mediastinum and is in contact with the esophagus. The area is largely formed by the left atrium, into which the pulmonary veins open. So also, like we repeated already, the base. Three components of posterior surface of the heart. Here we have the left atrium and pulmonary vein from the true posterior surface. Then only a small segment of the left ventricle contribute to the posterior surface. And the last part we have here the inferior wall diaphragmatic surface. Again, the picture of the deviation. Here we have the anterior surface, the posterior surface, and the lateral surface. And on the behind it, on the lower, we have the lower surface. So, repeating one more time, we have the facies sternocostallis cordis, the frontal part. The facies diaphragmatica cordis, it's the lower part, we don't see this here. Then facies pulmonalis cordis, we have here both of them. And the facies posterior cordis here, to the lining to the esophagus. Heart fixation apparatus, the ligaments of the heart, pericardium, envelope of the heart, in the middle of your chest. Here we see all of them: the arch of the aorta, the ligamentum vertebropericardialis, the superior sternopericardial ligament, here sternopericardial ligament, the lower, the phrenico-pericardial ligament, which connects the diaphragma with the lower base of the heart, the facies diaphragmatica cordis. Here the facies diaphragmatica cordis is connected with the diaphragma due to the ligamentum phrenico-pericardialis. Ligamentum phrenico-pericardiacum, so it's called. The phrenico-pericardial ligament are connective tissue bands that connect the pericardium caudally with the tendinous center of the diaphragm. They are thereby stabilized in the position of the heart in the thorax. Ligamentum sternopericardium. The sternopericardial ligament are delicate bands of connective tissue that connects the pericardium to the back surface of the sternum, here on the back surface, with the superior and the inferior. Then we have three ligaments: ligamentum vertebropericardiaca, ligamentum cervicopericardiaca, and ligamentum visceropericardiaca. Where we have them, here's the ligamentum vertebropericardiaca. Also on this picture we see it. Then ligamentum cervicopericardiaca, this we have in none of these pictures, and the visceral pericardiac we have also not foundable in these pictures. Here we have again the ligamentum vertebrophrenicardiacum, ligamentum sternopericardiacus superior, ligamentum sternopericardiaca, and the ligamentum phrenico-pericardiacum here. Another fixation which is mentionable is the mention to the nerve trunks, to the nervus vagus, the nervus longus recurrens on the right side. Under here we see it goes under the arteria subclavia, and the left side we see it goes under the aortic arch. And then we have the fixation with the sympathetic ganglion, and yes, that's the presentation. Thank you for listening. I hope you could remember everything and just rewatch it, pause the video, and have a good day. Learn anatomy. It makes fun. Bye bye.